Hello everyone, welcome to GrowMed. Welcome back. And guys, so this is the most requested video and the most awaited video uh, discussing the 100 most important topics for the FMGE, and I have made these topics or this PDF according to the list of the questions that are repeated like in every exam. Okay, so I am expecting that you can score easily around 100 to 110 marks from this PDF, because all these are the previous year questions and there are highly chances that questions can be coming from this PDF. Okay, so let's start our discussion without wasting much time. So the first important image is the GLUT and the SGLT receptor, and this is a must do topic. मतलब in every paper this question has been asked from so many years. ठीक है, तो divided into the, so this will be like a quick recall kind of a video जिसमें we'll be quickly discussing all the things, so that will be a short also and you'll be able to recall the things easily also. ठीक है, so see, GLUT 1 2 3 4 5 में divided किया गया है, and you need to remember all these things, and also along with that SGL1 and SGLT2. So you need to remember the location, like the one, brain, RBC, placenta and its function. देखो नाम में ही लिखा हुआ है ना, जी ग्लूट रिसेप्टर, तो ऑल दिस विल हेल्प इन द अपटेक ऑफ द ग्लूकोज. देर आर सम एक्सेप्शंस लाइक विच यू मस्ट रिमेंबर, लाइक दो द टू है ना, इट रेगुलेशन ऑफ द इंसुलिन रिलीज, ये एक्स्ट्रा पॉइंट है, नॉट एक्सेप्शन बट एक्स्ट्रा पॉइंट विच यू मस्ट रिमेंबर. तो ग्लूट 2 present on the liver, pancreas, small intestine and insulin release. So you can remember like integrate करके पढ़ो ना. सी pancreas है, this is the pancreas पे ये ग्लूट 2 रिसेप्टर प्रेजेंट है. सो वेन एवर वी हैव अ फूड नो, तो इंसुलिन कहाँ से रिलीज होता है? पैनक्रियास से ही तो रिलीज होता है ना. इंसुलिन रेगुलेट करता है ब्लड ग्लूकोज को, तो इसीलिए वेन एवर वी विल बी ईटिंग आवर फूड, तो stimulation are sent to the pancreas, and from that the SGLT2 will be sensing the amount of glucose present, and then it will release the insulin. ठीक है, so this one is like insulin regulation, release में ये regulate करता है GLUT 2. Then GLUT 3 present in the brain, kidney and placenta, same like the one, this one and this one. तो ये भी ग्लूकोज अपटेक को इफेक्ट करता है, मतलब ग्लूकोज के अपटेक को करता है. Then moving on to the GLUT4. GLUT4 very important and asked like repeatedly multiple times. GLUT4 के बारे में ही पूछा जाता है. ठीक है, so and the question asked is this one, that GLUT4 present on the skeletal muscles and insulin stimulated glucose uptake. Okay, so इसमें क्या हो रहा था कि GLUT2 में the insulin was being released by the levels of the blood glucose, regulating the blood glucose. but इसमें क्या हो रहा है कि इंसुलिन स्टिमुलेटेड ग्लूकोज अपटेक हो रहा है, मतलब स्टिमुलेट इज insulin present in the bloodstream. It is stimulating the cells to uptake of the glucose, and mostly present in the heart and the skeletal muscle. Then 5 present in the small intestine on the basal side, basal membrane, and absorption of the glucose. ठीक है, तो देखो absorption of the glucose तो common है, इसको इतना याद रखने की नहीं है ज़रूरत. The things you must remember is this one, like mug up these things by heart कर लेना इसको पूरा. Then SGLT1 present on both kidney and intestine, whereas SGLT2 present only on the kidney. ठीक है, so another important thing asked from this SGLT is in integration with the pharma, that this is a kind of secondary active transport, because in this the ATP is being getting utilized. तो इसमें क्या होता है कि there is exchange of the sodium and the glucose, इसीलिए that is the sodium glucose transport. Okay, so this was all about the receptors which you must know. Then moving on to the another very important topic, that is the vacunators, and questions have been repeatedly asked nowadays in the FMG. So they can give either the image or just ask about the content or the use. And I think in the recent Jan 24 exam they had asked about the sodium fluoride, that gray wala jo hai, you want to do the examination of the glucose, blood glucose you want to test, so which you are using the gray color and which content is present in it, or the additive name was asked, which is the sodium fluoride. Okay, then we'll discuss one by one all the things which you must know. So black color, the content is the sodium citrate and used to do the sedimentation rate, that is the Westinger sedimentation rate. Then blue wala used for content is the trisodium citrate used mainly for the ESR coagulation and the platelet study. Then red, no additive is present, so it is a plain tube. You can just remember like plain tube, red, plain, and serum analysis. So all the serum electrolyte वाला जो analysis है, these are done in the red. Then lavender में EDTA is the content, and this was also a PYQ, and ESR and CBC we will be doing it. Then ग्रे में सोडियम फ्लोराइड है, एस्टिमेशन ऑफ द ग्लूकोज. ग्रीन में हेपारिन रहता है फॉर द एबीजी, इलेक्ट्रोलाइट्स एंड द ऑस्मोटिक फ्रेजिलिटी. And then the yellow one, the content is the sodium polyethanol sulfate, and bacterial culture and HLA typing is done using this vacunated. Okay, so a must do topic, तो मगअप कर लेना ये सारे points, बिल्कुल भी miss नहीं करना है इनको. And then moving on to another very important from the surgery, that is the this cannulas. So anesthesia के integration में भी पूछ सकते, तो important from both the points. Then orange, this is the size and this is the needle gauge, the size of the needle, and this is the flow, how much amount of fluids can be given at the using this IV cannulas, and these are their indication. Okay, so this one is a PYQ that ATLS protocol में या फिर for quick blood transfusions we will be using the green color wala. And this was dehydration. This was also an PYQ that a person is having मतलब a person is severely dehydrated, and then which color IV cannula you will be using करके question पूछे गए थे. ठीक है, so you need to mug up all these things. Then moving on to another very important topic, JVP, मतलब arsenic integration with the physiology, then from the medicine, and you need to like remember all the things regarding this JVP कि किस disease में कौन सी changes दिखती है, and along with that you need to also remember कि कौन सी wave क्या signify करती है. Like here A states about the atrial contraction, S stands for the atrial relaxation, C for the tricuspid bulging, and this happens in the IVC phase, that is the isovolumetric contraction phase. Then downfall of the tricuspid. Then V say it will be passive atrial filling. This correlates with the IVR, that is the isovolumetric relaxation, and Y में atrial emptying will be happening. Okay, so these are the waves of the JVP, and this is the significance of these waves. So pathology of these waves. So A wave, three types of pathologies can be seen: absent, large, and canon A wave. If it is absent, seen in case of atrial fibrillation. So you can remember like atrial fibrillation में क्या होता है, absent P wave भी होता है ना, P wave नहीं होता है इसमें. ठीक है, तो मतलब कि एट्रिया ढंग से काम नहीं कर रही है, इसीलिए इन JVP also A wave is absent in case of atrial fibrillation. Then the large A wave seen in case of pulmonary atrial hypertension and pulmonary stenosis, मतलब कि जो भी pulmonary causes रहेंगे उसमें large A wave देखने को मिलेगा. And this canon A wave is a PYQ, so seen in case of complete heart block and ventricular arrhythmia. So I think these things are like quite easier for you now because अभी ये revision का भी time है, and I think you have already learnt about all those things. So large V wave seen in case of tricuspid regurgitation, a must no point, मतलब रट लो इसको, आप मगअप कर लो. ये large V wave tricuspid regurgitation. And another important is this one, ये cardiac tamponade का and even constructive pericarditis as well as this tricuspid regurgitation. तो cardiac tamponade में जो finding दिखती है, that is the X wave will be steep in it, and it will be steep in CP also, that is a constructive pericarditis, and absent in case of tricuspid regurgitation. See, tricuspid regurgitation में large V wave, absent X wave. And in case of the Y wave pathologies, it is steep in case of cardiac no, not cardiac, it's constructive pericarditis, and in case of the tricuspid regurgitation, and absent in case of the tricuspid cardiac tamponade. So see, cardiac tamponade is a very important topic asked in the surgery as well as the medicine, and the questions related to this cardiac tamponade can be described like patient shortness of breath, so and so, history दे देंगे. And the two important things which will be described in the case is, on JVP you can see steep X and absent Y wave. Whenever you see this, no, just blindly go and mark the answer as the cardiac tamponade. एंड ऑल्सो टू मेक योर वर्क ईजियर दे कैन ऑल्सो गिव यू एन एक्सरे जिसमें कि वो मनी बैग साइन दिखेगी जिसमें ऑल ओवर द हार्ट फ्लूइड भरा हुआ रहेगा एंड दैट विल ऑल्सो हेल्प यू टू कम टू द डायग्नोसिस एज द कंस्ट्रक्टिव cardiac tamponade. So another important thing from this JVP is that positive cosmal signs seen in case of three conditions: CP, RCM, restrictive cardiomyopathy, and third degree heart block. ठीक है, तो all except kind of question can be asked. You need to remember this one. Okay, then moving on to the anatomy, which is a very important topic from this, and that is the nerve injury. So image based questions have been frequently asked on this, and mark one thing that anatomy में ना mostly the questions are PYQs. तो PYQs ही ज़्यादातर repeat होते हैं, तो do look at all the PYQs in the anatomy. Then so the first image is of the Erb's palsy, in which there will be C5 C6 रूट वैल्यू की इंजरी हो जाती है. इसमें अपर ट्रंक ऑफ द ब्रेकियल प्लेक्सस इज इन्वॉल्व एंड दीज आर द चेंजेस विच यू कैन सी दैट द shoulder joint will be adducted plus medial rotation, then elbow extension and pronation at the radioulnar joint. Then this is also a very very famous question and a repeat topic, like asked in every exam. And winging of scapula, injury to the long thoracic nerve. Long thoracic nerve supplies the serratus anterior muscle which helps in the protraction. ठीक है, तो ये function है serratus anterior muscle का, and this is the nerve supply, this is the image. Then wrist drop, radial nerve. Then ape thumb deformity, benediction hand and the pointing index, all these three are seen when there is injury to the median nerve. Then claw hand, so this is called as a partial claw hand because only two fingers are being clawed in this, and this one is due to the ulnar nerve injury. And when there is complete claw hand, there will be injury to the ulnar as well as the median nerve, and this is also called as a Klumpke's palsy, and the injury will be to the inferior trunk of the brachial plexus, that is the C8 T1. ठीक है, so mostly the lumbricoids muscles will be involved in this and they will be causing this clawing of the hand. Then Saturday night or the crutch palsy, wrist drop due to the radial nerve injury. Okay, so I've already uploaded a complete video on this nerve injuries, so do watch that video also. The link will be given in the description box. Then moving on to the dermatomes. Okay, so dermatome, this is also very important and frequently questions have been asked on this. So C6 dermatome is the dermatome of the thumb. Then C8 little finger and ring finger. T4 present at the level of the nipple, PYQ. So they had given the image. तो image दे देंगे एक person की, and they will be marking the level of the nipple and they'll ask what is the vertebral level here. So it will be the T4. Okay. Then level of the umbilicus, it is the L T10. Okay, see you need to look in the question कि dermatome पूछ रहे या फिर vertebral level पूछ रहे, because dermatome is the T10 but जो vertebral level है ना umbilicus की, it is junction of the L3 L4. Okay, so do remember this point also because there are chances that we can get confused, and also sometimes in a hurry we will not be reading the question properly and there are chances that we can make a mistake. Okay, so do look at the questions twice and check what the examiner is trying to ask. Then L4 medial side of the great toe, repeat topic. Then medial malleolus को they can give a mark, मतलब कि they'll give a leg here and they'll mark the medial malleolus and they'll ask what is the dermatome, or they'll ask the medial side of the great toe. S1 lateral foot, lateral margin of the foot and the little toe, and S234 perineum. Okay, so these are the important dermatomes which you must know. Then moving on to another very important topic, that is the Myasthenia Gravis. So in every year you go and analyze, if you go and analyze in the past is like every paper this Myasthenia Gravis question is being repeated. So comes in integration with the pharma, then medicine, then कभी कभी surgery में पूछ लेते, ophthalmology में भी पूछ लेते. बहुत बड़ा टॉपिक है एंड बहुत सारे सब्जेक्ट्स में फैला हुआ है. ठीक है, तो यू कैन एक्सपेक्ट अ क्वेश्चन फ्रॉम दिस वन ऑल्सो. सो ऑटो इम्यून है, एंटीबॉडीज बनेंगी न्यूरोमस्कुलर जंक्शन पे एंड अगेंस्ट द ACH रिसेप्टर. तो जाहिर सी बात है ACH रिसेप्टर्स पे एंटीबॉडी बन रही है तो क्या होगी, ACH की एक्टिविटी कम हो जाएगी. ठीक है, सो ऐसे याद कर लेना. ट्रीटमेंट वाला पार्ट हम अभी डिस्कस कर लेंगे यहाँ पर. दैट ACH is reduced, so our aim should be to increase the ACH, and how we will be doing it we will discuss later. Most commonly seen in the females and the elderly males. Females most common because most of the autoimmune diseases most commonly seen in the females. And the Clinical features seen in this myasthenia gravis: muscle weakness, fatigue, fluctuating diplopia, and ptosis and diplopia. See, whenever you see these things in the question, right? Worsening in the evening, better on rest. So a female coming with the muscle वीकनेस, मेनली द आई मसल्स, ठीक है, आई मसल्स की वीकनेस हो रही है रेस्ट पे या फिर अप्लाइंग आइस पैक. So whenever you see these three things, the buzzwords given in the question: better on rest, applying rice, worsening in applying ice, worsening in the evening, go straight away with the myasthenia gravis. ठीक है. Diagnosis में we will be using the tensilon test and we will be giving the edrophonium. And drug of choice the neostigmine and the pyridostigmine, important from the pharma. ठीक है. तो पूरा पूरा clinical case they can describe and they can ask what is a drug of choice, how will you treat the patient, or they can just ask you how you will diagnose the condition. So it will be the tensilon test. Okay, so these are the important things which you must remember from the myasthenia gravis. Then let's move to the pediatric developmental milestones. So these are the list of the various developmental milestones which you must mug up. So the social smile occurs at the 2 months previous year questions, then at 3 months head and neck control, holds objects in the hand, then 4 month, 5 month bidextrous. Okay, so this the ones which I've marked with the star mark, no, those all are important and you need to mug up all those things. Like sit with support 6 months, monosyllables 6 months, stranger anxiety PYQ 7 months, then stand with support 9 months and bisyllables 9 months, then 12 months पे stand without support, walk without support, and 2-3 words with meaning. ठीक है. And mature pincer grasp also 12 months. Then 15 months में walk without support, tower of 3 cubes, important है, previous year question था ये, PYQ पूछा गया था. 18 months में up and down, feeds with spoon. Then 2 years पे tower of 6 cubes is an important, this one is an important, copy a line at 2 years. Then dry by day, this is also a PYQ. ठीक है. तो over 2 year में they'll be just describing like the child is able to draw a line, then the child is able to say that he wants to go to the toilet at the daytime, then he goes upstairs and downstairs करके ऐसे they can describe 4-5 things and they'll ask what is the age of the child. Okay, so it will be the 2 years. Then 3 years में upstairs by alternate feet and downstairs 1 feet per step, rides tricycle, so try 3 years tricycle. 9 to 10 cubes tower and copies a circle, so circle wala is a PYQ. Then tells age and sex and 3 word sentences and try by day, so this is also PYQ. Try by day 2 years, try by night 3 years, try by day 2 years. ठीक है. So important things from this third year. Then in the fourth year, the thing which you must remember is this copy is a rectangle or a cross. ठीक है, बस इतना याद रख लेना fourth year के लिए. And fifth year के लिए copy is a triangle and knows full name and gender. Okay, so a PYQ was asked describing all these things and they had asked what is the age of the child. So it was the 5 years. And these are considered as some red flag signs that if these do not occur even at the particular age group, then that will be called as the red flag. Like sit with support तो आना चाहिए 6 months में ना, sit with support 6 months, but it is considered as red flag if it does not come till the 9 months. अगर 9 month पे भी नहीं आ रहा, then it is called as the red flag sign. Okay, so ये सारी चीज़ें भी you need to remember these things. And one mistake is there here, guys. This is the 18 months, so single word by the 18 months, so please make the changes in your PDF also. Then Seile Hematoma and the caput succedaneum, again a repeat topic. तो हेमाटोमा मीन्स तो वी नो दैट हैमरेज होगा, ठीक है. एंड कैपुट सक्सीडेनम एडिमा, तो कैन रिमेंबर लाइक सक्सीडेनम थोड़ा सा रिदम में आ रहा है एडिमा के, तो सक्सीनेडम एडिमा, तो दैट वी कैन रिलेट दैट it is the edema. So appear 24 to 48 hours, disappears by 5 to 7 week, and jaundice can be seen, मतलब कि it precipitates jaundice, and do not cross the sutures. This one is important. And this caput succedaneum present at the birth disappears by 48 to 72 hours and crosses sutures. ठीक है, तो जल्दी appear होगा, जल्दी भी लेट डिसअपियर भी होगा. ठीक है, अर्ली अपियरिंग and early disappearing, that one is the caput succedaneum. But cephal hematoma mein it will take time to appear and also take time to go, like it goes like 5 to 7 weeks. And another important differentiating factor is the sutures. So if it crosses sutures, it is caput succedaneum, and if it do not, then it will be cephal hematoma. So you can remember like S से sutures, S से succedaneum. तो succedaneum sutures cross करेगा, cephal hematoma नहीं करेगा. And this can also be given in the clinical case. तो clinical case से भी like a pediatric child present at birth, you see a swelling present at the head, and on examination you see that it is crossing the sutures. ऐसे ऐसे करके they can describe, and these will help you to uh, identify the correct answer in the options. Then moving on to the another important topic, that is the grafts. So this is also a repeat topic, and grafts mein all you need to remember is classified into the four types. Auto means self, allo means same species, iso-twin, xeno different species, और animal में. ठीक है, you need to mark up these things क्योंकि एग्जाम्पल्स देते हैं ना क्वेश्चन में, that a patient he had undergone a road traffic accident and now he wanted some part to be replaced or some part to be changed. So his twin brother gave him that part. So what kind of graft it is? So it will become isograft. Then a question can be also asked like mother, a patient था, patient के में कुछ transplant करना था, then mother gave the organ. So what kind it is? So then that time it will be the yellow. And जो हम वो करते हैं ना wall replacement, so wall replacement is an example of this xenograft. ठीक है, because we take it from the animals na. Then transplant rejection, so this is also an important. So transplant rejection, two types of transplant rejection can be seen: host versus graft and graft versus host. So host versus graft again divided into hyperacute, acute and chronic. Hyperacute, देखो acute तो मतलब we all know ना that these things will be appearing अर्ली मतलब जल्दी जल्दी होती है ये चीज़. अब हाइपर एक्यूट का मतलब है कि उससे भी अक्यूट से भी कुछ जल्दी हो रहा है, तो दैट वन विल बी कॉल्ड एज द हाइपर अक्यूट. सो द रिएक्शन occurs within minutes to hours, and this reaction is mainly due to the pre-formed antibodies, which are mainly the humoral immunity, and this is a type 2 hypersensitivity reaction. This is very important because questions are asked like hyperacute is which kind of reaction and all. Then acute occurs from weeks to month, and pre-formed antibodies, if they cause, that will be type 2, and if cellular T cells are involved, then it will be the type 4. Then chronic months to year, and T cells are mainly involved in this. So this was a PYQ, that which of the following cells will be causing the chronic type of graft rejection. And this is a type 4 hypersensitivity reaction, which is also called as a delayed hypersensitivity, because it is like see, you can see ना कि टाइम में बहुत टाइम ले रहा है ये डेवलप होने में, दैट्स व्हाई इट इज कॉल्ड एज द डिलेड. And also along with this now you need to remember ki which all are the type of the hypersensitivity, the examples of the type hypersensitive, type 1 2 3 and 4 कौन से type 1 में आते हैं, like the allergy वाला, then bronchial asthma, then type 2 में आता है RH positivity, and various other examples are also there. Then type 3 mostly the autoimmune diseases like the SLE and all, and type 4 में the reactions caused by the T cells. So these are the examples which you must remember, so you need to mug up that all the things also. Then graft versus host, so this is mainly seen with the bone marrow transplantation, because the recipient cells will be attacking the donor cells will be attacking the recipient cells in case of the graft वर्सेस होस्ट. ओके, तो जो ग्राफ्ट है वही होस्ट के सेल्स को डिस्ट्रॉय करने लगता है इफ लेस देन 100 days, acute, chronic more than 100 days, and it is a type 4 hypersensitivity reaction, and earliest organ to be involved is the skin. Then RNOT phenomenon, it is also a repeat topic, and frequently questions are asked like on the drug of choice. So it is the calcium channel blocker which we will be giving. So it is an exaggerated vascular response to cold temperature or emotional stress. So clinical case, if at all they describe ना, they can describe two things. A female, क्योंकि ये autoimmune है, ठीक है, तो फीमेल तो कॉमन रहेगी. देन एक्सपोजर टू कोल्ड वाटर, और शी वॉज वॉशिंग क्लोथ्स इन द कोल्ड वाटर. देन comes with the color changes of the finger. And what is the diagnosis? बस इतनी तीन चीज़ें काफ़ी है to make the diagnosis as a Raynaud phenomenon, and if they give the image it will be quite easier for you all. जैसे कि वाइट पैलर हो गया, वाइट हो गया, ब्लू हो गया, फिर रेड हो गया, ठीक है. सो क्वेश्चन वाज आस्क्ड लाइक द सीक्वेंस ऑल्सो. द फर्स्ट इट इज वाइट, then it turns into the blue, then it turns into the red. So this is also PYQ. So remember the sequence also of the changes of the finger color. Then classified into primary, secondary and clinical features तो हमने describe कर लिया था, and also the calcium channel blockers which are the drug of choice. Then pheochromocytoma. See, pheochromocytoma is also a repeat topic, and so it is a tumor of the chromaffin cells. Most common site is the adrenal gland. Second most common other site where it can occur is the organ of Zuckerkandl, and this type is called as the extra adrenal because adrenal में होगा तो adrenal है ना, but organ of Zuckerkandl adrenal में नहीं है, तो it will be the extra adrenal, and this kind is known as the paraganglionoma. Then, so the pathology is that there will be increase in the epinephrine and the norepinephrine because it is the tumor of the adrenal medulla. So medulla क्या secrete करता है? Epinephrine and non-epinephrine. तो उसकी secretions बढ़ जाएगी and it will cause increase in the autonomic symptoms. तो autonomic symptoms में क्या क्या देखने को मिलता है? Hypertension, then sweating, palpation and the tachycardia. तो heart rate increase, palpation, sweating, hypertension, orthostatic hypertension, ठीक है. So this is a triad of this pheochromocytoma, and इनकी कैटाबॉलिज्म भी बढ़ जाती है. सो इन यूरिन वी कैन सी VMA. So this is the investigation of choice for screening investigation of choice, and this was a PYQ, whereas the particular investigation of choice is the plasma fractionated metanephrine levels. So these both were the PYQs, and the treatment surgery है drug of choice. This is also PYQ asked in integration with the pharma. It is the phenoxybenzamine or the phentolamine which are the alpha blocker. Okay, so let's discuss कि अगर clinical case देंगे so they'll be describing an elderly male or a female. चलो मेल कर लेते हैं. Male and with complaints of tachycardia, increased heart rate, then palpitations, and on examination you can see a palpable mass present at the suprarenal region. ऐसे करके they can describe a full clinical case, and they can ask what is the investigation of choice, or what is the diagnosis, or what is the treatment of choice, or what is the drug of choice, ठीक है. So this is all about the pheochromocytoma which you must remember. So these are the infectious diseases which are important from the pediatric. Then the vitamins, so already uploaded a complete video of this vitamins, so do watch that video also. The link will be given in the description box, ठीक है. Then okay, so that's all in this video guys. In the next video we will be continuing the other topics like the vitamins, hemorrhage and the pneumothorax and all the other important topics in the next video. Okay, till then stay tuned for more amazing things related to the FMG, and join my Telegram channel. If you like the video, please comment below and share the video with your friends. Thank you so much guys for watching this video. I am Dr. Padmini, your mentor for the FMG, and stay tuned for more amazing videos. If you're new to GrowMed, subscribe to GrowMed. Thank you so much guys. Bye bye.